We'll give you a minute. All right, tell me when we're ready. All right, good afternoon. I want to thank everyone for joining us. On June 15th, our state and our region moved beyond the blueprint and lifted the tiers and really embraced and started our recovery. We stopped our weekly press briefings at that time, but from June 15th until today, we have continued our response to COVID-19, continued to make vaccines available, continued testing, continued to monitor both cases, variants, hospitalizations, and the impact of everything, and all of those efforts will be ongoing. We're here today to just provide a quick update on vaccinations, on cases, on variants, along with being able to answer questions. We've gotten an increased number of questions in recent days, and we thought it was appropriate that we make ourselves and our doctors available. We're also very pleased today to be joined by Dr. Crumpler from Sharp Healthcare, a physician, to talk about the importance of the vaccine. Our primary message today is the need to get vaccinated. We are doing incredibly well in San Diego County. Our recovery is going incredibly well. That is in full swing. And we continue to see vaccination numbers that are some of the highest in the entire country. Almost 80% of San Diegans have received their first dose. Almost 68% are fully vaccinated. But we also are seeing an increase in COVID cases. But those cases from March 1st until today, 95% of those COVID cases are in the unvaccinated. 98% of the COVID hospitalizations from March 1st today are in the unvaccinated, and 96% of the deaths from COVID-19 from March 1st until today are in the unvaccinated. The simple fact is, in order to slow the spread of COVID, we need people to get the vaccine. And so we're here today to urge San Diegans to please, it is safe, it is effective, it is free. We're asking you to trust your medical doctors. You don't have to listen to me. We have Dr. Crumpler here who will talk as a physician on the importance and the vital safety protocols and steps you can take by getting the vaccine. We're also here to urge San Diegans who got a first dose but not a second dose. About 140,000 San Diegans received a first dose but have not yet received their second dose. Please go get your second dose. That second dose is what provides your full protection. And so we continue to do well as a region. Again, our recovery is going well, our vaccines are going well, but we are here today to talk about that. There's been a number of questions about the Delta variant. There is a delay. It takes time to sequence these tests, but right now we are at 54 cases of the Delta variant in San Diego County. We do believe by August it will be the dominant variant in San Diego County. In many parts it already is. But out of those 54, more than 90% of those again, are in those individuals that are unvaccinated. So we continue to urge you, get your shot. If you have one shot, please get your second shot, and please trust your doctor. If you have any concerns or questions, or you're hesitant to get the vaccine, reach out to your doctor. Talk to your doctor. If you want to talk to a second doctor, talk to a second doctor, or a third, or a fifth, or a sixth, or a seventh. If you want to talk to 10 doctors, talk to 10 different doctors and see what they tell you. Because the science is clear and the medicine is clear. And so again, we're just here today to provide that update. I want to introduce Vice Chair Vargas to give an update, and then we will hear from Dr. Crumpler. After that, we'll be available for your questions, and we have both Drs. McDonald and Dr. Shaw also here available for any questions. Supervisor Vargas.
Thank you, Chair Fletcher. And, this is really a call to action to make sure that we remind everybody that we've come a long way with the vaccinating our communities, and we're really, very proud, particularly in South County. We are at 85.2% of our communities that are eligible in the South region that actually have received their vaccine. And 84% of Latino Hispanic residents have received their first vaccine as well, but it's really, really important that we emphasize to individuals in our community that they need to get their second shot, number one. And we do know that there's a large percentage of our Latino community that has not received that second shot, so we want to make sure we encourage that. Particularly as we're seeing the variants on the Delta, et cetera, we want to make sure that our communities get vaccinated. So if you're in this group, make sure that you get your second vaccine so that you are fully protected. Muy buenos días, estamos aquí con todos ustedes una vez más para recordarles que en nuestra comunidad la importancia de recibir su vacuna contra el COVID-19. Hemos llegado ya muy lejos desde que inició la pandemia y hace unas semanas pudimos abrir nuestra comunidad y economía. Pero como comentábamos antes y como comentaba el presidente de la Junta de Supervisores desde su inicio, cuando eliminamos restricciones el 15 de junio, aún tenemos mucho trabajo por delante. Uno de los retos más logrados que todos los que no se han vacunado reciban su vacuna. Ahora más que nada les queremos pedir que si no se han vacunado, vayan a recibir su vacuna. Hemos visto que el número de casos ha incrementado en estas últimas semanas y ahora con la variante Delta tenemos que seguir teniendo muchísimo cuidado. No queremos volver al nivel de restricciones que tuvimos anteriormente y mucho menos queremos perder más vidas. Si aún no tiene su vacuna, por favor busque el sitio más cercano a usted. Sabemos que la mayoría de las personas infectadas con la variante de Delta han sido personas que no estaban vacunadas. Y es importante recordarle a ustedes que 95% de los casos desde marzo son de personas que no han sido vacunadas. Entonces, el mensaje de hoy es, si no se ha vacunado, por favor, váyase a vacunar porque está poniendo en peligro a las comunidades cuando no lo hace. Es importante enfatizar que el 84% de la comunidad latina tiene su primer dosis también ya de vacunas, pero hay muchas personas que no han ido por la segunda, así que queremos enfatizar que no dejen de ir por su segunda vacuna, así que más que nada recordarles que vacunarse ahora más que nunca es importante. Vaya con su doctor si tiene alguna pregunta o con la clínica de salud más cercana a ustedes. Gracias.
I think all of us, both in our own health and certainly if you have kids, you rely on your personal physician. You trust them, you listen to them, you engage with them. And so today we wanted to give an opportunity. We are incredibly grateful for all of our healthcare providers and doctors throughout San Diego County, everything they've done over the last year and a half. But we really wanted to highlight and feature a local physician, someone people turn to representing the broader physician network to really speak about the vaccine and what he is seeing with his patients, what he's encouraging them to do, along with having him available in the Q&A too. And so we're so grateful for Dr. Hans Crumpler for joining us today. We appreciate everyone at Sharp and everyone at all of our systems, and we thank you for joining us today, and we will turn it over to you. Dr. Crumpler.
Thank you very much, Chair Fletcher. Thank you, everyone, for allowing me this opportunity. The virus is real. I have heard so much about the hoaxes and the conspiracies. I had the virus myself, and it is not fun to get. And to be able to speak to patients to say, I know what it feels like. I know what the patients who have called me in extreme distress, and I've had to tell them, hang up the phone, please go to the hospital. The devastation that this virus causes is preventable, and the fact that we have the vaccine that's so highly effective is unprecedented in our civilization. The fact that we were able to come up with the vaccine within just a time frame of a year of this virus breaking out, and the fact that it's widely available, the fact that we've had so many patients that have gotten their vaccine here in San Diego alone and now nationwide and worldwide is unprecedented in human history. I just talked to a patient yesterday and asked them what their hesitation was about the vaccine. And they said, well, the side effects and the fact that it may have been formulated from the artificial intelligence. And I said, I had the opportunity to meet Dr. Jonas Salk when I was at UCSD. The man devoted his entire life to wiping out polio. And the blessing that we have here in the United States is that we don't see wild cases of polio on a regular basis. I've been to parts of the world where they do have polio. I've seen the devastation that it causes now. When we were in the midst of the polio breakouts in the 40s and 50s, our President Franklin Delano Roosevelt was a victim of polio. We didn't have the technology that we have available now, so let's use it to our advantage. It is survivable. It is something that's going to give you side effects. When I had my vaccine, I felt sore in my arm for a couple of days. But in comparison to having COVID, I would much rather have that. The only times that I've seen patients have any degree of side effects that have been concerning have been a breakout in a rash, or they've had some degree of GI upset. But there is nowhere near the effect of the virus on the body as the vaccine on the body. So in talking to patients and addressing their hesitations, I have to pose it to them that the effectiveness of this vaccine, as Council Fletcher has talked about, this is real. This vaccine is highly effective. The fact that we have it, the fact that it's available, the distribution issues are no longer an issue now. It's widely available. It is easy to get. 211 San Diego has been a lifeline for so many of my patients that I've told them, turn to it, use the resources that we have. The blessings that we have here in San Diego of availability, of accessibility, of technology, of media, of getting these messages across. I've practiced in very rural parts of the United States where access was a real issue. Here we do not have those issues. So I beg my patients to really consider when they have those hesitations. I tell them, you don't hesitate when you put on your seatbelt when you're driving. What's the difference? If they fear the side effects, if they fear some kind of untoward reaction, it's manageable. Tylenol, Motrin, Advil, the medications that the CDC themselves recommends you to take, treat the symptoms as they come along when you have the vaccine. But it is so much more dealable than fighting your body aches that are beyond belief, beyond description, being incapacitated, not being able to move. I remember having had the virus itself, and being in bed for 24 hours straight, not being able to get comfortable, breaking fevers and chills. It's incomparable. Get the vaccine as readily as you can. For those who have not had their second vaccine, I implore you, get your second vaccine. The availability is not an issue. It is widely available. It is easy to access. Come to your physician, come to your medical provider, ask them when you have those questions. Turn to the CDC. There is always reliable, sensible, common sense information coming from the CDC. That is their charge. I have worked with physicians who were in charge of the CDC, and I have no hesitation in trusting them at all. That is my turn to for the latest, the CDPH, the information we get here from our own health department, our officials that are widely trusted and very, very educated about this process. So I ask my patients, I ask all the patients in San Diego, everyone who is able to get the vaccine, get it as promptly as you can. Those who haven't had their second vaccine, get it as promptly as you can. Those who are at the higher risk populations, get it as promptly as you can. Those who have not been vaccinated in the eastern half of the county, that is where my practices are based. I beg you, please, get your vaccine. Come to your provider. Ask the questions that you have on your mind. Anything that you have is a doubt, a fear, a hesitation. That's why we're there to help educate you. But the number one message is to get that vaccine.
Thank you, Dr. Crumpler. At this point, we're happy to take any questions for us, for Dr. Shaw, for Dr. Crumpler. Shannon?
Is there a renewed push to get people vaccinated? Obviously, a lot of sites shut down, things slowed down, whether it's door-to-door campaigning or things like that.
Well, we're going to continue to make them available. It's not a belief that it's a lack of availability that's stopping people from getting them. They continue to be widely available. And our availability changes on an ongoing basis with mobile sites and other sites are available healthcare providers. It's just more getting people to be a little more motivated to get vaccinated. And so, it's free, it's safe, it's effective. You can find it anywhere in the county. So we are going to continue, though, to make sure it is widely available. Even though it is lower numbers, we do think that that's an important investment to continue to make, and we will continue to have countywide availability. Good. Any other questions?
What's the worry if people don't get vaccinated?
Worries you get COVID. I mean, 95% of the cases from March 1st until today of COVID cases are those who are unvaccinated. 98% of COVID hospitalizations from March 1st till today are those who are unvaccinated. 96% of COVID deaths from March 1st until today are those who are unvaccinated. And so we have a safe, effective, and free way to not spread COVID. And so we're urging people. You know, we know that this works. We know it's safe. We know it provides the greatest protection.
This morning, the CDC released guidance for schools. I'm not sure if you can talk about this or one of the other ones, but I think it might cause some confusion for parents. The CDC says one thing, California says another thing. What's the messaging that parents need to take away from what the CDC said this morning?
We're still reviewing it. It just came out this morning, so our doctors and team are still reviewing it. Obviously, we're going to follow in California. Our state schools will follow the CDPH guidance. And, you know, a lot of things can change between now and the fall when most of our kids go back into school. So we'll continue to monitor it. You know, we will defer to CDPH guidance, but we'll certainly take a look at CDC and evaluate all of that as we move forward.
Remind me if you can too. Out of all the positive COVID tests, are all of them tested?
No. This is an important point. Not all of them are. So the two important points on this. One, there is a lag in terms of it takes a few weeks to do the sequencing. You know, to be able to do them. Now, out of all of the tests that are being sequenced, we're only at about 10 to 15% of those are coming back Delta variant. That is much lower than the state of California as a whole. And we don't have absolute clarity into what percentage of all tests are being sequenced because of the nature of testing and how many different locations do it, and some of the samples can't be tested and whatnot. So we believe we're doing more sequencing than probably anywhere else in the country because of the dominance of those Scripps labs and other folks that are here. But again, there is a lag time, and it is not every positive test is able to be sequenced.
So the thought is maybe the numbers would be much higher if you could test all.
I think it would be natural to assume they would be higher than what we know.
And I know like the state last month in June, they said that 42% of all the sequence cases were Delta variant. LA higher as well too. They asked people to put masks on because of that. Do you know why we're seeing a 10% compared to the state, just so much higher?
Dr. Shaw addressed why our kind of overall percentages of Delta is a little bit lower.
Along those lines, do you expect that to shoot up drastically like LA County just?
Well, no, we can't predict now. We haven't been predicting for a year and a half. So I don't know if we can predict, but I'll let Dr. Shaw talk to that overall.
Again, so your specific question was really around why just 10% as compared to 40%. And again, I think that Chair Fletcher already sort of alluded to the fact that there is a delay. I think it will become our dominant variant within a couple of weeks, but again, there's just that delay, and we'll know more as time goes on. But again, it's not about, the point isn't about the variant. The idea is the reason why it's spreading is there are unvaccinated individuals. If they get vaccinated, this won't be a problem. So back to the basics, okay?
I know you guys talked about introducing this 24-hour test before. You guys think people want it, but they don't have ease of access. Is some of that stuff still on the table?
I mean, we'll do whatever we got to do to make it available. I don't think the problem today is that it's not available. I think folks generally know the vaccine's available. It's easy to get. It's accessible. I think now it's just getting into some of that hesitant population. And all we're saying is, hey, call your doctor. Call your doctor. If you have concerns, if you're unsure, call your doctor. Ask them what they think. And you know, we think it is available. I also want to just I mentioned this earlier, but this drive the point home. Out of the 54 Delta variants, we have 49 of those were in people not fully vaccinated. So if we want to stop the spread of the Delta variant, it's really easy. Get vaccinated. Jim.
When we spoke a couple weeks ago, this was after LA reinstated some mask guidelines, and you said at this point, no plans for that.
Yeah.
Have you changed your stance as we've seen more Delta variant cases here locally?
No, 95% of the cases are in the unvaccinated. So the guidance we're giving is get a vaccine. If we want to slow the spread of COVID, we need people to get the vaccine. That is the single most effective thing, and we will continue to monitor and we'll continue to align with CDPH guidance.
Is there a threshold where you'll start to look at reinstating restrictions?
We will continue to align with CDPH guidance.
Is there any areas for those 140,000 people that have not been yet vaccinated or get the second doses, or the ones that have not yet even, got one? Is any particular area north, south, or east?
Yeah, we see some pretty high rates of unvaccinated in East County. some of the more rural areas in the north, along with some different pockets in different places. Those are the areas where we have the lowest vaccination participation. On the 140,000, Carlos, I haven't looked at where those folks are. I don't even know if we would know that. But those are folks who got their first dose but not their second dose, and that's probably a little bit less hesitant. You know, they were willing to get the first dose. It's just a convenience. You get busy, you forget about it. And so at whatever point it was you got your first dose, it's just get your second dose now. And that will provide you greater protection.
I said not everyone who takes a test that it's possible to have it sequenced to test for the Delta variant.
That's correct.
Because why is that? Is it just because of like, how fragmented the testing is?
Yeah, well, I'll let Dr. McDonald walk through some of the challenges around sequencing. But again, it is my belief, and Dr. McDonald can confirm this, we are doing more sequencing than perhaps any other region because a lot of that sequencing technology is organic here to San Diego County. But I'll let Dr. McDonald speak to some of the challenges about sequencing every test.
I think that's a great question. You know, there are some countries that have nationalized health systems that are able to systematically sequence every single test that comes up, whether it's Denmark or the UK. We don't have such a system in the United States, so because of different entities that are doing testing and not all of them able to get those samples in to the laboratories that do this specialized work, that's one aspect of it. Another aspect is that you have to have enough virus to be able to sequence in the first place. And so not all tests, although they're positive, they indicate infection, they're not high enough in terms of the actual count of the virus to actually do the sequencing. So that actually significantly limits the number that are actually eligible to be tested in the first place. So that has a significant factor. But the capacity we have here in San Diego to do this testing is really more robust than pretty much any other place in the country. So we've been able to leverage that to be able to communicate about what the variants have been over time. I think you might remember that we were one of the first jurisdictions in the United States to pick up the Alpha variant, or the so-called UK variant. That actually became dominant here before it became dominant in other places in the country. It just so happens that this specific variant took a foothold elsewhere before becoming an issue here. And again, different viruses circulate in different communities in different ways. And we're able to describe what's happening in here in San Diego because of this capability that we have.
Dr. McDonald, quick question. Can you just reiterate for people who got their first, didn't go back for their second, it doesn't matter how long it's been, you'd rather them go back for the second now?
Yes, thank you for that question. It's about, what's the timing of that second dose. As long as you wait the appropriate amount of time, depending on the shot, whether it's 21 or 28 days, you need to wait that long. But after that, it doesn't matter when you get it. Ideally, you want to get it on time, but even if it's been a month, 2 months, 4 months since that first shot, getting that second shot, you don't have to restart. You just need to get that second shot. It's important because specifically for the Delta variant, one shot is not enough. There have been some studies recently coming out, particularly from Israel and the UK, that first shot doesn't give the same protection for that variant that it does for the others, which is, again, why we're emphasizing shot number 2 makes a difference.
What do you think about Pfizer pushing a third shot?
I think it's really too early to talk about boosters. I think there will probably be a time where boosters will be done, and we need a lot more science. In fact, the recent announcement by Pfizer would like to see the data behind that, and I think it's important to evaluate that along with the other information from other companies about boosters before we really talk about that. It's more important that people complete their series and then expect down the road that there may be boosters that come, but let's have people complete the series first.
Real quick, if I can too. The message today seems to be about anybody who hasn't gotten the vaccine, go out there and do it. I know kids under the age of 12 still can't. We've seen a lot of kids getting lots of stuff over the last month or two. Masks are coming off, they're exposed to more things. So we've seen numbers of kids under the age of 12 going up. And what's the latest in terms of vaccines? Do we know? Are we a month away?
That's a great question. I don't know when actually the EUA will be extended to those lower groups. We do have some trials going on here in San Diego, actually specifically looking at the younger age groups, and we're hopeful that will happen in time for the school year to begin. But again, that's just something that will be decided at the federal level. Certainly the age groups that have the highest numbers of cases in San Diego, it's actually the 20 to 29-year-old age group is the highest, followed by actually that teenage age group, which is the second highest. So that's where our cases are coming from. But most of those people actually are eligible for the vaccine. Goes back to our point. If you haven't been vaccinated, get vaccinated.
And what would you guys say to somebody who maybe had COVID and had to say, I haven't needed it, don't need the vaccine?
The question was about, hey, I had COVID, I don't need the vaccine. Actually, that's an interesting question that is being addressed scientifically, and the building evidence is that for even people who have had the infection, getting the vaccine actually does give them an important added benefit to not become reinfected down the road. Again, I'm going to defer to my virology and immunology experts at UCSD to explain exactly why that is, but there is building evidence that it is important for those who've had the disease to actually get vaccinated when they are eligible for it.
Are you guys seeing any trends in the new cases? You said you saw a small uptick, just like about 100 a day, and are these like contributed to the blueprint going away, like parties and stuff, do you know? Are there any trends now in the cases that we didn't see before?
I'm going to let Dr. Shah answer those questions because she's really more dealing with those numbers day to day.
So Dr. Wooten alluded to this as we were, getting rid of the blueprint guidance, but we did see, we expected an increase in cases. We are seeing that uptick in cases. But again, the vast majority of these cases are occurring in those that are unvaccinated. So if we want to go back to, keeping our current way of life, then we need to get more individuals vaccinated. So yes, there is an uptick. We're monitoring that as we're monitoring the variants, but yes, again, the vast majority, as Chair Fletcher mentioned earlier, they're occurring in unvaccinated individuals.
Like through contact tracing, are you guys finding out that it's happening like at parties or something, or it's happening at workplaces a lot?
No, it's happening with unvaccinated. 95% of the folks are unvaccinated. That's the trend.
Yeah, and our outbreaks are staying steady, but again, it's those individuals that continue to have those cases. So.
Just a quick follow-up question. Dr. McDonald mentioned that the Delta variant may not be, or if you've only had one dose,
Correct.
it looks as though the Delta variant, you can catch that. Of the 54 cases here, how many of them had just one dose? Do we know?
No, we don't. Great question, and we can actually follow up offline once we get that data, but I thought about that today, so.
For those who are unvaccinated still and seem to think, well, the only harm to not getting a vaccine is myself, and then you hear that 95% of new cases are people who are unvaccinated anyway. What is the argument to potential harm beyond just yourself if you don't get vaccinated?
Right, it's spreading disease, right? So we know that we can, unvaccinated individuals especially can transmit a lot of COVID. So it's really important that it's not just about you, but it's about the community you live in, your family that you live with, that you need to get that vaccine, so.
Thank you, Dr. Shah. Thank you, everyone, for joining us again. Real simple message today. Listen to your doctor. Listen to Dr. Shah. Listen to Dr. McDonald. Listen to Dr. Crumpler. Get the vaccine. The trend is the cases that we are seeing today are in those who are unvaccinated. The hospitalizations, the deaths, those are all in those that are unvaccinated. So if we want to slow that spread, slow those hospitalizations, slow those deaths, we need people to get fully vaccinated. So if you have not gotten your first dose, please do. And for that 140,000 San Diegans who got one, please go out. Find a way. They're widely available. You can get them accessible, multiple locations. It's free, it's safe, it's effective. Let's get that in. And then again, it's worth noting San Diego County is doing very well. I think that there is a lot of positive out of our COVID response, a lot of positive around our vaccination rates. We continue to surpass most other areas. And so we're very grateful and appreciative for all of those San Diegans that have been a part of getting us to this position and allowing us to reopen. So with that, thank you. We will continue to provide regular updates on the numbers, and then as needed, we'll join you again. Thanks, everyone.